I have been so looking forward to this segment. So a lot of people take vitamins and supplements. Fish oils, multivitamins are part of so many people's daily routines, but apparently not all are recommended anymore as those guidelines have changed. Nine Health expert Dr. Payal Kohli is joining us to break this all down. I'm fascinated, and I know everyone in the newsroom right now is like, tell us about this. So first, let's talk about fish oils. Recommended or not?
No, in fact, most of my patients that are on fish oils, I take them off of it. And let's talk about why. So there were some observational studies where we saw people taking fish oils maybe did a little bit better. So we followed that up with what's called randomized studies, which is we said, okay, you take nothing and you take a fish oil. Let's see if we reduce heart attacks, strokes. There was no outcome evidence to show that they were better. Then we started seeing that they could actually have a signal for harm. In other words, fish oils can thin your blood, so they can cause antiplatelet effects, which can cause increased risk of bleeding. They can cause an arrhythmia called atrial fibrillation, which is an electrical problem with the heart. They can spoil. And when you're taking an over-the-counter fish oil, Corey, you're taking 70 to 80 different components, some of which can actually raise your cholesterol. So you think you're doing all this good by taking this fish oil, but it's actually doing harm.
It's so crazy because you were here, we were talking about cholesterol, and I was like, yeah, but I take my fish oils and multis, and she's like, yeah, don't do that. I'm like, what? So what are your thoughts about multivitamins?
Same thing. So the U.S. Preventive Services Task Force recommends for most adults that have a good diet, they should not need a multivitamin. Dr. Kohli says food is your best medicine, not pills, but food. So really try to balance your diet, fruits, vegetables, nuts, whole grains. And if you do that, you should not need a multivitamin at all. Because multivitamins taken can actually potentially, again, just like fish oils, have some kind of potentially harmful effects. Now, there are certain people that do need a multivitamin, so let me be clear about that. If you have any kind of gastrointestinal problem, like a malabsorption syndrome, ulcerative colitis, Crohn's disease, any kind of GI things, or other vitamin deficiencies like vitamin D, then your doctor may recommend that you take a multivitamin.
Okay, so, but now, and I was kind of running through the list of what I take, right? And there are some that you do recommend, especially for people who live in Colorado as well. Talk about what you do recommend people take.
Yeah, so certain deficiencies are more common here in the United States. So if you're over the age of 55, you can be at higher risk for B12 deficiency because your gut changes the way that it absorbs B12. So you probably should be taking B12 fortified foods. Vitamin D is a big one. You know, we spend a lot of time indoors, even though we have a lot of sun here in Colorado, a lot of us are vitamin D deficient. So you should check that vitamin D, and if it's low, then that is a good one to supplement in your diet. If you're pregnant, you need folic acid. You probably remember from your pregnancy. Yeah, because you're using up a lot of folic acid, so you need that. If you're taking certain other drugs like Nexium or Protonics, they can actually affect the way that your body absorbs B12 or calcium. So you may become deficient in those vitamins. So if you're on medications, you talk to your doctor about which ones to take. But for the general person, just taking a multivitamin is not a good thing for health.
How interesting. I know everyone's going through their pill boxes right now, like I could take that one out and that one out. Talk to your doctor first, of course. But Dr. Kohli says, I love that. Thank you so much for coming in. Really appreciate it. I know everyone's been interested in what you were going to say about that. Ed?